I first start with Guangwai Shield, then SARS kicked in. So my wife and I, we were volunteer at the gate. Also, we need to wear spacesuit to check their temperature all day. Till today, I still feel that it's really a very sweet memory for me. How I interact with the elderly is that I can associate with their thinking, their feeling, so also give me the advantage of serving them.
Francis actually stand out. This is one volunteer that really helped us, the younger generation. I think he is also a very great mentor. He also continuously give me ideas like where can I bring my residents to. He even recce the place before sharing the idea with me. Indirectly, he has already become like a member, a family member for my residents.
They staged it as stage 3 colorectal cancer, meaning needing immediate attention. When you go through such an experience, and in my case, the prognosis was 50%. That means every 2%, 2 persons who go through the treatment, one will make it, one will not in the 5-year period. So I made it, so I'm one of the other lucky person. So which in itself is a gift and a blessing. Immediately after the treatment was over, but I was still recovering, I told myself it's time to give back to the community, to the society. Today I volunteer with the Sing Health Patient Advocacy Network, SPAN, the Singapore Cancer Society, as well as Tan Tock Seng Hospital.
One of his biggest contribution is actually leading the Train the Trainer. What really stands out is how generous he is with his time and how well he actually communicated his patient perspective in a very constructive and respectful manner.
Very gratifying to know that there are others who are in a similar situation and we are all coming together, we are there together.
MND is actually a group of rare neurological diseases. Your motor neurons progressively break down such that you lose your motor functions. The first ability that I lost was to jump or like tiptoe.
We're up to about 180 members now. We believe there's about 300 people in the country, 330 people who may have motor neuron disease. What that means is still over 200 or so people or more living in some isolation. I think getting people together, it's empowering.
I think the most memorable one for me was Purple Parade 2023. When we sent our application and then we managed to get a booth and a contingent, I was actually really happy because I think it puts MNDA there, like we exist.
I still remember at that first Purple Parade when we were marching down that stretch of road and there were so many supporters and they started clapping and cheering for us. I actually felt like tearing because it was so amazing. I mean, like, we have supporters. I just feel that we are not alone in this journey anymore.
Gutsy warriors, and the pun is totally intended. Gutsy because it's a gut, of course, and the courage of all the people in the support group to overcome their disease and to help others. For me, one of the major things is to show the patients with the condition that there are still a lot of things you can do. Right? Of course, there are some things you can't do. You can't do like Taekwondo or Muay Thai, but you can do things like dragon boating.
Everybody will share what we know in terms of dieting, travels, yeah, and then exercise.
As a healthcare professional, what we see is that they are stepping up and you see that they are really enjoying their life. Initially, they are of their fear, they have overcome it, and now they are confidently living their life. I think that's what we felt that is successful.
Ben and Grace, they have been very involved in their volunteering spirit.
我是在2000年，然后在这边做。之前我是在教会里面做，然后一个弟兄跟我讲这边有请人，叫我来这边要不要做了？我跟Grace， 我们都是可以讲是夫妻档这样啊。我们做的时候没有抱着很大的东西，就讲。 金钱我们都懂，可能不是很多，我们只要在这边做，能够完成神给我们的心愿，在这边帮助人。Grace 的人，他是一个很细心的人，又有爱的人，我只能够讲。 他很疼那些，他很疼那些老人家了。他讲了一些话，他讲你不帮助他们，谁帮助他们呢？所以我们来这边做的时候，都是同样的一个心智，帮助这边的人。
I was very touched by Ben and Grace that they would organize the CNY Eve reunion dinner for the lonesome folks staying in this estate. It is a very personal space and time. They would themselves also bring their children. This year, CNY reunion dinner, his son came again, and this time son is a social worker, and he was helping, he was replacing mom already. Of course, when the folks saw Grace's son, they felt a large part of Grace was still with them.